Good morning. Welcome to Diane's Kitchen. No, it's not a cooking show, but it's a place where we sit down with interesting people and learn things that you probably didn't know before. This morning we've got a kind of a serious conversation. No, it isn't kind of a serious conversation. It is a serious conversation, and it's about veterans and suicide. September is Suicide Prevention Month for the VA. This is something that happens every day, and there are two women, one in Minneapolis this morning and one in Burnett County, who want to talk to you about what they know. Before we get started and I introduce them to you, I want to thank Baron Electric once again for being our sponsor. If you've got the newsletter, if you are a Baron Electric member, co-op means you're part of the company, you might be interested to know they are ahead of the curve. Up in Trigo, which is getting a major facelift this year and into next year with the highway, Baron Electric has put in, if you can believe it or not, a level 3 DC fast charger. In other words, if you have an electric car, you can go up to Trigo and charge your car at the Prime restaurant. It's good for everything. It's good for Trigo. It's good for the Prime restaurant. It's good for Baron Electric. 2035 is the year that the government would like to see everybody in an electric car. They're going to have to come down considerably in price before I'll even look at one, but that's just me. So, Baron Electric, thank you for being so progressive. There's going to be a big to-do, a grand opening September 28th from 11 to 1 in Trigo on the highway at the Prime restaurant. If you'd like to see the charger station, or if you'd like some cookies and coffee, it's free. Okay, let's get started with this subject. I would like to introduce to you two women, Ella Parker. Ella, your official retirement, what would you call it? Your moniker, what you were in the Army,
Oh,
rank. What was it?
yeah. I'm a retired major in the United States Army.
Somehow I feel every time I talk to you, I should salute. I don't know too many majors, and the field you were in just intrigues me. What was your job
My, my
description?
MOS, yeah.
Yeah,
So
well,
what MOS stands for is a military occupational specialty.
that's the
And
one.
yes, so I was a major in the United States Army Veterinary Corps. So I'm a veterinarian, and I performed such while I was in the service.
We, you know, it's kind of like let's make up a game. Let's pretend that, we can do this or we can do that. I want to be a vet in the Army. Sure.
Right.
Nah. What were some of your jobs as a veterinarian in the Army?
Sure. Yeah, that's it's even surprising. Most military people ask me that as well, because we're probably one of the smallest
Yeah.
corps in the military, and um, we were started back World War One, but it actually started way back farther than that in the Civil War, with all the food poisoning that they were getting from canned meat and what have you. So they brought on what they called butchers, or it's the first time veterinarian type things, that they weren't called veterinarians back then, but they did all the horse care, because of course the cavalry was the only way
Right.
transportation wise, right? So they had to have somebody to take care of the horses. Plus the public health portion of that. Before there was a public health department, veterinarians did that, and we still do. Within the veterinary corps, we do food inspection as well as animal care. So then it kind of evolved as the future evolved, and now presently, what there's shockingly, people don't what they don't know about the veterinary corps is that it's not just about taking care of animals. And then everybody's like, well, what kind of animals? Well, our main missions are the military working dogs. The military is very robust in military working dogs that do um, uh, they're drug sniffing dogs, bomb sniffing dogs, patrol dogs. So they play a big part in not only what's called CONUS life or over, stateside, but overseas when we're deployed.
Hmm.
Also, we have the caisson horses that are still around, and over in Afghanistan, there was the mules and the donkeys that carried weapons over the hills, right? So they need veterinary care.
Right.
We also have a marine mammal program. So yeah, right. So we've got the dolphins and the seals and that type of thing that find underwater mines. So we've got that. Then
Wait,
there's
wait,
another.
wait, wait, wait. What?
I know, right? It's yeah. You don't really think about that
No.
very much, but yeah, there's an actual program for that. Um, and what they do is that they're great. Those dolphins and other marine life can be trained to spot underwater mines and other obstacles, that type of thing. So it's pretty interesting work. So we do the veterinary side of that. Their animal care and health.
Mm-hmm.
So the military does very much care about their other service members, their four-legged service members, their swimming service members, and then another huge piece of our mission is food inspection or public health.
Mm-hmm.
So we actually did get rolled into the U.S. Public Health Command a couple years back. So we provide food inspection prior to cooking, and then the public health department does it at cooking and after. So
Sure.
we do that. The other part that people don't realize is research and development. So we're talking about, we've got pathologists, virologists, immunologists, toxicologists that are all veterinarians, but they're also specialized. So my specialty was surgery. So I did the clinical animal part, as well as every major base overseas and in the United States has a veterinary clinic where service members can come and do their if they have animals that they, pets, they can take them to the clinics that are on base for low cost veterinary preventative care. So yeah, it's a kind of a unique core. I think there's only at the time, I think there's around 750 active veterinarians within the military. The other unique thing is that we actually, even though we wear the U.S. Army uniform, our orders came from the Department of Defense. So we are the DoD executive agents for veterinary services for all branches of the service. So my first duty assignment as in the Army was the Great Lakes Naval Training Center in Chicago, North
Mm-hmm.
Chicago. And then I actually, when I deployed to Iraq, I deployed, with my unit, but I was stationed and with the Marine Corps. So we cover all branches, yeah.
I would imagine you could put any of that in a trivia quiz and nobody would get any of it. It would say, yeah, you're making this up, right?
Yeah.
Okay, Andrea Sandberg in Minneapolis. Beat that.
No way. I'm bowing out right off the bat.
You're a wise woman.
Yes.
How do you come to your job, Andrea, and what is your official title?
Yes, ma'am. So I'm the Minneapolis VA Suicide Prevention CEPC, and that stands for Community Engagement Partnership Coordinator. So, of course, we in the VA love acronyms. Essentially, my role is to do community outreach for suicide prevention. So we know that most of the veterans who die by suicide are not in VA care. So my role is to go out into the community where they're working and living and thriving and meet them and their family members where they are. And of course, when I say veterans, I also mean service members, right? So they could be in the Guard or reservists or active duty individuals as well. I know that veterans and service members are different, but for the purpose of my work, I want to be all inclusive. So, and so I've been at the VA for 10 years. I'm an RN by trade. And I worked previously in the comprehensive pain clinic and then on the inpatient spinal cord and injury and disorder unit. And then prior to my work as a nurse, my undergraduate degree is in mortuary science. So I was a funeral director
Wow.
for about 2 years full time. Yeah, before I went into nursing. So, and had a lot of obviously very interesting and difficult experiences as a funeral director, but really grateful for that history, that work history coming into my work now, because I think it's given me a very different perspective than a lot of folks have. So, yeah, and went to school for both my undergraduate and graduate here in at the U of M in the Twin Cities. So I've been pretty local for most of my life. So
when you meet people at a gathering, at a party, at something fun, and you tell them a little bit of your past, like you just told us, do they just draw a blank and stand there and look at you? Or do they
usually
actually?
interrupt to say either tell me more or stop talking. That's one or the other.
You
Um,
have an interesting resume.
I do. Yeah, very interesting. And I wasn't actually a familial, it's not in my family to own a funeral home. So it was a very interesting when I first told my parents that's what I wanted to do. They're like, "What? Where did this come from?"
What happened to teacher or whatever?
Right.
No,
Right. So I think they were happy with that transition into nursing. They're like, "Okay, we can get with this."
well, yeah, I imagine it was tough to get a date.
Yeah, right. I held that off. Yep, that little special fact about myself I waited for
Yeah,
a few months.
I definitely would. Tough to bring up.
That's right.
So you've gone from funeral person, nursing, and now you're in a field that I would imagine would be difficult only because the people that you really need to reach, I don't want to say refused to meet or be reached. But this is something, it's like these marriage enrichment seminars that you're invited to, or, you could look, should we go? No, I don't want people to think we're having trouble in our marriage, but we are having trouble in our marriage. But they couch it with, this will enhance a good marriage. Very few people there have a good marriage, and nobody wants to be stamped with this, oh, I guess they're having trouble in their marriage. How do you reach out to people who have reached that point in their life that they feel there's no hope? How do you find them? How do you reach them? And what do you tell them?
Yeah. So I think those are great questions and actually very insightful. So a lot of work in suicide prevention, really in the last few years, I think, or at least in my involvement, we certainly have moved to what we call more upstream. So we don't want to always be fighting in crisis, right? With that person who's at the end of their rope. In crisis and has nowhere else to turn. Certainly, there is a place for that, and we have clinical interventions for that at VA. But really, in suicide prevention work, we really want to move more upstream. So, what are the risk factors that are causing an individual to get to that point? And so, we talk about things like home security, food security, isolation or connection, right, is a huge issue right now with COVID-19. And then financial issues. Is there job loss? Can we help with that? Is there education, that we could maybe be providing the individual, whether that's higher education, getting them into college so that they can get into the job force, or is that education on risk and protective factors so that a family member might notice if someone in their family is struggling with some mental health crises and or depression and or feelings of being suicidal. And those things aren't exactly hand in hand, which I think is really important. A person who dies by suicide does not necessarily need to have mental illness or mental health issues. It's really, there's no single cause for suicide. It's really a conglomerate of risk factors, some protect factors that have compounded with a lot of different elements in one's life that might lead to that. So, what we tell folks, I guess, is it depends on where we are meeting them in the spectrum. So, in my role, it's mostly going out to educate community members. So, I'll do trainings for 3M or for Ameriprise, and we talk about our SAVE suicide prevention training. And that acronym stands for signs of suicidal thinking should be recognized, ask the most important question of all, validate the veteran or service member's feelings, and then expedite getting to care. And so we just want to educate people on some of the risk factors they might notice in a coworker or a friend or an acquaintance, so they can be looking out for signs and symptoms that might be leading, that a person might be struggling with life. And then I think for individuals in crisis, what's really important, so we have the Veterans Crisis Line, or the VCL as we call it. So that's the National Suicide Prevention Lifeline. When you press 1, you're connected directly to individuals who are well trained in working with veterans and service members, most of which are veterans or service members themselves. And so I should say veterans, most of them are veterans themselves. So when a person connects to the Veterans Crisis Line, they could be in immediate crisis. They could be a family member who's calling
Mm-hmm.
for, say, a son or a wife or someone who might be struggling, trying to get, hey, we want to get them connected to care. These are the actions I've been seeing them do lately. What would you recommend? What would be the next steps? And the Veterans Crisis Line can be helpful in an acute situation when it's emergent, and then also maybe at a time of calm when the individual just wants help and direction for how to help
Okay,
their loved one.
let me interrupt you with a couple of questions.
Yeah.
Um, First of all, when anybody commits suicide, does the family, as best as you can answer, do they ever go, I never saw the signs, or we were all worried about COVID, we were all dealing with isolation, we're all dealing with loss of jobs, but I don't know, we didn't realize he was taking it so hard. Are suicides surprising? It's like, I never thought he'd take his life. Or are
Yeah,
there
great.
obvious signs?
Yes, I would say both answers to yes or answers to both questions are yes. So sometimes people have had warning signs, right? Hindsight, they look back and they say,
Right.
I guess I did notice that they were withdrawn, but I didn't think it was this bad. And sometimes people will have more warning signs and maybe have a heads up. But I would say, that really is all over the spectrum, and it just depends. And there's so many different individuals, I think, that die by suicide, that they may have had promptings or thoughts for some time, or it may be, hey, in the last 10 minutes I've really lost hope, and I don't know where
Mm-hmm.
to go, and I don't have direction, and I just feel like my coping mechanisms are not enough for the stressors that are coming in. So I would say that it's both and. Some people do have warning signs and some people do not.
Ella, you are a veteran service officer in Burnett
Yes,
County.
correct.
On a daily basis, you go to work and you service veterans. There are questions, they come in, some of them are totally clueless, and they sit down with you, they talk.
Hmm.
What can you offer? I don't know if I should start with that. You've probably got 1,000 programs that you can offer.
Yeah.
What advantage are you to a veteran who's never come in and sat down with you before? Because there's a lot of them that really should come in. Why?
Absolutely. Yeah, so just to give you a little bit of background on the County Veteran Service Officers, in the state of Wisconsin, um, every county has a County Veteran Service Officer. We are not employees of the VA, we are employees of the county. So your taxpayer dollars, if you live in our county, you're paying for my salary.
Hmm.
So what we act as a liaison between the veteran and VA services. So all of them. We do the healthcare side, the benefits side, the cemetery side, and federal and state benefits. Excuse me. I'm sorry. I'm dealing with bronchitis right now, so I apologize.
Why not?
Um,
It's fall.
yeah, right. Um, so what is nice is about our program and the CVSO, the County Veteran Service Officers, the state of Wisconsin, is that we see that veteran first. We're right there, and we have access and knowledge of all these programs because, for better or worse, the VA is a big animal. It is very complex, and sometimes it is overwhelming, and you just don't know where to start.
Sure.
So when we talk to veterans, we kind of get an idea of, just like Andrea was saying, the spectrum of where they're at. Now, if we think that um, they are in a serious crisis where they need immediate help, we have, the resources, local and with the VA, to kind of expedite that. But if they're, just sitting here talking to me, and sometimes I can just mention the word mental health you doing? And I will instantly get, you know, tears or evasion or what have you. And I know it's bothering them, but it's not to the point yet that I believe they're in crisis. So that's the time that I can get involved and say, hey, let me tell you about some of the programs that are out there, whether it's through the VA or through some state programs that we have, um, or even, you know, if they don't necessarily qualify, or if it's a family member, even and they don't feel comfortable or don't qualify for the VA, we also have local resources like the crisis lines through the counties that they have their own, or other things. So we're kind of the first line sometimes of seeing these people that have no clue about the VA, are and so we can give them kind of guidance and actually do the paperwork and help set up to get them enrolled in what we need them to get enrolled in, and make those first calls for them to get the assistance that they need. And I'd rather catch them
Right.
at the time
Right.
when they come in here instead of a full-blown crisis.
So
And that's what Andrea and I think, you know, between us and the VA's goals is to get them early. So we're not fighting an uphill battle.
So you've got somebody in your office, you ask a question. Suddenly everything changes. The conversation changes, the room changes, and you realize, wow, this person is in crisis. You say the word program. Does that turn them off immediately? What they need is a hug. You know, I'm a big hugger anyway. But, you know, to say, well, we've got a program for that. Do they
Well, I don't.
respond, or do they, no, that's okay, I'm fine? How do you get
Well,
them to understand, no, this is for you? This is
sure.
somebody that you might want to sit down and talk to.
Right. Well, I don't, when I talk to veterans, I don't come out if they start doing that. I'm like, hey, we got programs. No,
Yeah.
I don't do that. I actually
Good.
talk to them first. I say, what's going on with you? You know, like what's, and you know, and some people don't know me from Adam. So,
Yeah.
and, you know, veterans, for whatever reason, we're typically closed off, paranoid, what have you. Right.
Yeah.
And some of the things that we are dealing with in our mind are not something that we feel comfortable bringing up just in everyday life. You know, a lot
Sure.
of them are what are called moral injury. So you bring that up to a typical civilian person or somebody that can't really empathize with that,
Right.
and they are horrified maybe, or you think they're going to be horrified by what they hear, so you just keep it in. You
Yep.
don't know who to talk to.
Yep.
So what I do is I actually will talk about my story. Um, so the things that I've experienced, and what led me to also reach out to the VA. So I have
Perfect.
personal experience using both the VA, uh, mental health services, the vet center services, that we'll talk about a little bit later, and the success that I had with it, and the struggle that I had, and even just the approach of going to get help is very, you know, you deal a lot with anger and shame and guilt and embarrassment, and I let them know that that's okay. Like, and I will tell you my story because it helps me relate to them, saying you're not alone.
Don't you think this is your biggest gift?
I
Biggest
I
gift?
feel blessed to be able to
Right.
share the things that I can share, because even if I can help one person, I think that that is uh, that's probably one of the best things I can do with the skills that I have.
And I would think if I was sitting across from you and I was really down, I mean, big time down, not just for today, but it's been building and building and building. And suddenly to be sitting across from somebody who's been there, done that, to me it would be like, oh, thank goodness. And the floodgates would just open for me. Someone that can relate to me, not somebody
Right.
with just another program, let's sign you up. But,
Sure.
you know, you've reached a part of me that nobody else could.
Right, and I think that also telling them that, hey, the VA, it's, you know, the VA has improved tremendously in the
Yeah.
last 10, 15 years as far,
Yes.
especially with mental health. And to say that, hey, it's not scary. It's not, nobody's going to take away your rights. Nobody's going to lock you away and throw away the key. That's not the goal of the mental health services through the VA and through the other programs that we have. And that it's not, I get, the other thing that I get a lot of is, well, I don't think that I deserve mental health. There are a lot of other veterans worse off than me.
Right.
It should go to them.
Yeah.
I don't have a reason why
Right.
I should be feeling this way, and that is incorrect. Every service member's um, time is unique, and every experience is unique, and
Yeah.
it affects people different. It affects people differently um, for all cases, and it doesn't have to be wartime PTSD. It could be military sexual assault. It could be things they've seen and done or were asked to do that were
Yeah.
something that was a part of their job, and it was implicit for the mission that they had to do, but it may have gone against their morals that they've grown up with. So now they're in constant conflict with themselves and don't know how to explain that, or don't think anybody's going to understand.
Right.
And that's the goal, is to get them to people that do understand and that can work with that problem. And it doesn't mean their problems are any less than any other veteran. They're just different, and they all deserve to be treated, so that person can live their best life, because these people serve their country, and now we want to get back to them to
Right.
allow them to be, successful in their own lives.
I think you used a very appropriate word when you said embarrassed. You know, I think because we're Americans and we're this and we're this, and especially, the guys, they're guys. But we all have problems, and the wise person finds someone to help them with those problems and not to be embarrassed. Andrea, you've been nodding your head. What do you want to add to that?
Yeah, I just fully support what I'm hearing Ella say, and I think it's really important to. I've heard the same thing. A lot of veterans saying, "I don't deserve the care. Give it to someone younger than me. Give it to the young guys coming back. I'm older, whatever it might be." And I totally agree with what Ella is saying. Everybody is entitled to this care who is a veteran, and we really want to make sure that people are enrolling and taking advantage of their benefits. Right? They've earned these benefits, and so it's their right. And like Ella says, I think that the VA is a huge, it's the biggest healthcare system in the US, and it can be really daunting and confusing and overwhelming. And we're really lucky to have CVSOs that are
Yeah.
helping, like Ella, to guide folks through that process. And if the VA isn't the right choice, maybe it is a vet center. Vet centers do kind of more peer to peer counseling. And so it's not as intimidating as driving down to Minneapolis and trying to find a parking spot and walking in this huge hospital and,
Yeah.
all the things that come with that. So, and even outside of vet centers, right? Maybe community care is the best. Maybe a person has a primary care provider that they've gone to for 15 years since they've been out, and that's who they love to talk to and they're most comfortable. Then we need to find a way for them to get that assistance and that help. So just in total agreement with what Ella is saying.
And
Yeah.
how do you do this? How do you reach the guys, the few World War II guys left, the Korean guys, to come in and sit down and sign up? How do you get them in the chair?
Yeah, so I'll just say for my end, and Ella can probably answer better on her end too. But I think that a lot of work that VA does is we really want to, if it's an individual who's a little bit older who maybe isn't using technology, right? They're not on social media,
Right.
they're not seeing Facebook, they're not using their smartphone for apps to find out, that VA is offering X, Y, or Z, or the different programs that we have. I would say it's trying to reach family members. It might be a daughter or a son that's saying, you know what, Dad, you're getting older. You really, they're aware that maybe medical bills are increasing and that we might be able to mitigate that, right? If they were getting their care at VA or through the VA system. And we have many clinics. We call them community-based outpatient clinics, CBOCs, throughout Minnesota and Wisconsin. I mean, all over the U.S. But specific to our area, where they can get services on a smaller scale in their own community, which is still
Yes.
through VA. Yeah.
Yes. No more getting on the bus, driving hundreds of miles to get help.
Mm-hmm.
There's probably one in your community.
Yep.
Yep.
Yeah, and to add on to that as well, I think most of the CVSOs, but I know for sure, sorry,
It's okay.
here in Burnett County, we have telemedicine. So, we live in the rural area. A lot of people's Wi-Fi is not good, or they don't have that technology. So we actually have iPads here where veterans, if they do have appointments coming up with mental health or actually any telemedicine through the VA, they can actually come to our office. We put them in a room with an iPad, and they can do their appointments there if they don't have the access to
Sure.
at their homes.
Or they're not comfortable with electronics.
Correct.
Okay. Time is amazingly,
Great.
it's just flying by. What else would you like to bring up that's important this morning? Either one of you.
Well, I have some other resources that I'd like to talk about. I know that we were going to have some other guests from the vet center in Vorp, but I think time wise, we needed it. So, but I'm going to give out some of that information and just talk about that a little bit, if that's okay.
Good.
Okay. So the VA also has kind of an arm to it that's called the vet centers. In our area, specific to Burnett County and most of the Northwest Wisconsin, we fall under the La Crosse Vet Center. So the vet centers are a really nice alternative to VA or in conjunction with. So I've used both, and I think they're both fabulous. The director of the La Crosse Vet Center, her name is Carrie Porter, and she's fabulous. What's different from between them and the VA is that they provide mainly readjustment counseling. They don't do any medications or anything like that. They just do the counseling part of it. And I'm going to read here what Carrie sent me to read over about what the vet centers are. So they are readjustment counseling services. They provide readjustment counseling to individual groups, couples, and family counseling to talk through problems, brainstorm solutions, and discuss resources that are available, and work with veterans to create effective and practical plans for personal growth. And then here's a very important thing that veterans, and this was actually started because of Vietnam veterans and whatnot, but this is, remember how I alluded that sometimes we're paranoid and angry and we think everybody's out to get us? Yeah. This is a very important thing. Their records cannot be accessed by any part of the VA or Department of Defense, any military units or other community networks and providers without the veteran's permission, or unless it's required if there's a life-threatening situation. So their records, it doesn't even go into their VA records at all. So this is very confidential, and it's important, especially when we've got active National Guard reserves or people that are active duty that do have mental health, because there is a stigma there. I know the military is trying to work on that, but there is that stigma, and nobody wants to show that weakness, because that's not what the military is about, right? We are told to hang strong. Bite the bullet, right? Yeah. Rub some dirt on it. Pain is weakness leaving the body. Right? So we've come to say that, wait a minute, then we can't, to do our job effectively, how can we show weakness? And we take mental health as a weakness, and it's not. Yeah. It's just the way we're dealing with our bodies. So they, so the vet center, they are a great resource to have. They do, although they come out of La Crosse, you do not have to go to La Crosse. We actually, up until recently with COVID, we had an in-person person that was up here that would come to a few of the counties around here once a week to see people face to face. They are currently doing phone or telemedicine right now, and they should be starting up face to face again. Yay! Hopefully soon. Yep. but they cover so they cover combat veterans, military sexual trauma, readjustment counseling. So that's if you don't know what that is, readjustment counseling is actually kind of a big deal, and it's not necessarily that you have a mental health problem. It's that the culture in the military is so different from civilian life, and when you transition out, and especially
Yes.
up here where it's very rural, very isolating, and
Yes.
not a lot of resources that you would have in the cities. Um, it I struggled with it very hard,
Hmm.
and I didn't know what it was at the time. I had no idea why I was doing the things I was doing and why I was ostracizing my family and pushing people away and just wearing my anger like a blanket. And
Hmm.
I didn't understand where that was coming from because, um, my job in the military, parts of it transferred to the civilian world, but not all of it.
That's
And
right.
so doing things in the military you can't do that in the civilian world. It doesn't work that
No.
way.
No.
And so they help you with that readjustment into civilian life
Good.
so you can function more effectively. So they're a really important resource. And I think at the end of the show, or maybe in the comments, I believe we're going to have the phone numbers for these places.
Okay, just in case, could you give them now some important phone numbers?
Yeah, I absolutely can.
Okay.
So, um, so what I have is, so the vet center specifically for us in our area is 608 782 4403, and
And that,
that takes you right to the La Crosse Vet Center, and then you just tell them what county you're in, and that you're looking for services,
okay?
and they are really good at calling you back, getting you set up, and they will work with you on what works best for you as far as work schedule or anything like that,
Good.
to be able to help you. The other program that I would really like to talk about is it's called the Veterans Outreach and Recovery Program. This is a Wisconsin Department of Veterans Affairs program. So this is a state program for the state of Wisconsin. It was started, I think, probably 5 or 6 years ago as a pilot program. And I have to say, because we live in the rural Northwest, sometimes we get forgotten
Ah,
about in the state of Wisconsin.
you think?
Right. But this is probably one of the most important programs that the Wisconsin Department of Veterans Affairs started up, in my opinion. This gives us an outlet for when we need to reach out to somebody and we need somebody now. So
Right.
what the VORP program is, it stands for Veterans Outreach and Recovery Program. There are 11 regions. Our region is Region 4, and it's covered by an amazing man. He's a retired veteran. His name is Paul Huber, and his phone number is 715 558 2557, and you can call or text him. But what the veterans program is it connects veterans to community services and provides case management and support with a special focus on treatment and recovery. So what if I got a veteran and I'm like, I they may not qualify right now for VA, or it's going to take a little bit of time, and I need somebody to get eyes on this person right now
Hmm.
because they're either imminently homeless, they need AODA treatment, um, they're struggling with finding a place to live, which we also have options for as well. But I can call this person, and the point of these outreach people is to go to the veteran. They can drive to that veteran's house. If they're in a hotel, if they're stuck in their car, they can show up here. They can show up if they're jailed.
Sure.
They'll go to the jail. And what they do is they cover mental health services or help locate mental health services, substance abuse treatment, financial assistance, housing and utilities, claims and benefits. Usually they send them to us. Employment and education, transportation, and some other services. But I have to tell you, Paul Huber is gold, in my opinion, for our area because without him, he's one of the resources we have to reach out, and we can get him here almost immediately. Um, so I really want to plug that because I think out of all the programs that Wisconsin Department of Veterans Affairs has, this is probably one of the most beneficial for our area, especially for mental health services. So along with, of course, the CVSOs. Now I've got a whole list of CVSO phone numbers for your viewing area. So I think that, I can send them along, and we can hopefully get those in the comments or whatever,
Sure.
just so they have the phone numbers, because there's quite a few. I don't want to have to read them all out, but
Okay.
that first phone call is always the hardest. It
Sure it
always is.
is. Sure.
And so, if they're afraid to reach out to the VA, because it is sometimes a little daunting,
Sure.
but I would recommend that, if they do, they reach out to, this, Andrea or the suicide prevention team. Just because it has the name suicide in it doesn't mean that means you have to be imminently suicidal.
Right.
That's not what this is. This is mental health.
Right.
But if they want something more local, and we know where to start, we can get them to the right,
Right.
even if it's just talking to them a little bit, or their family members, because that's the other important thing, is that this video isn't just geared towards veterans. This is for family members and friends of veterans that maybe had no idea that there are a lot of these resources out there for us. So even if the veteran doesn't hear this, hopefully a family member can, and then they have somewhere to turn, because
Yes.
even the crisis line is made for for families and friends that can call about issues they've seen in other veterans. So I'll plug the one thing. The Veterans Crisis Line is 1-800-273-8255. And for veterans, you press 1, because that is a national crisis line as well. So anybody can call that number. Or you can text to 838-255, or you can go to www.veteranscrisisline.net. So there's different options that you have to connect with them. And then, of course, the VAs, Andrea talked about the C-Box. So the Rice Lake, up in our area specific, we have the Rice Lake VA C-Box. We have the Hayward VA C-Box, and then we have the Twin Ports VA C-Box in Superior. And then, of course, Minneapolis. And then there are clinics close to the border, Maplewood, Ramsey. And then I do, just real quick, I went to, there are some inpatient treatment centers for mental health. And I went to the St. Cloud VA's RRTP program and their PTSD track. And I got to give a shout out to them. They saved my life. It was a very wonderful program. And what I like to tell people is that the VA cared about me when I couldn't care about myself.
Wow.
Yep. And so I got to give a shout out to them, because that was, they really did their job, and they did their job well.
Well, that's good. And this whole program is to let people know this isn't your grandfather's VA anymore.
That's right.
The VA is dealing very effectively with all sorts of things that maybe years ago would have been swept under the carpet, but now it's wide open. Sit down, let's talk about it. Andrea, do you have any closing thoughts, any closing information you would like to give?
Yeah, I think Elle did a great job with some of the resources. Some of the C-Box too that I was just going to say, kind of up in that northeastern Minnesota area. We have Hibbing, a clinic in Hibbing, a clinic in Ely, Chippewa Valley, Wisconsin, right? And then she had mentioned Twin Ports too. And then also there are just tons of resources for mental health specific to veterans and service members, both in the community and through different organizations. And so I'm not sure if we could maybe put those in a chat or get the numbers, because again, like Ella said, there's just tons of resources, and most of these I have online connections for them. But I would say too that if anybody has questions and can't remember a phone number to go with that Veterans Crisis Line, the VCL phone number, call them. They will give you good direction. They'll hook you up with whatever, if you want within VA care, if you want outside VA care, whatever you need. And again, that Veterans Crisis Line number is 1-800-273-8255, and then you press 1.
Excellent. And remember, every county has a veteran service office and officer, and if they don't know the answers, they'll find out for you.
That's right.
Please give them a call. It's worth it. If you're a family member, if you're the person, give them a call. What's it going to hurt? You can always listen to the program and go, no. probably won't say no, but at least hear what they've got. We've got to go. We are already out of time. Big surprise. Thank you, ladies. I think this was something that needed to be said for a long time. You're out there. You're waiting for their call because you've got telephone numbers. You've got connections. So why not have people call you? Get signed up. You're a veteran. You haven't signed up yet. You haven't sat down in a chair and talked to
Right.
somebody. What are you doing?
Reach out.
Yeah.
Yes.
Just
That's
stop
what
in.
we're here for. Yep.
That's exactly right. You guys do a great job. So I have to say goodbye to you both, ladies. Thank you again for all of your help and your information. And I would encourage everybody, don't forget, Trigo, Wisconsin, tiny little Trigo, Wisconsin, at the Prime Restaurant on September 28th from 11 to 1. You want to know about electric cars? You want to know about charging stations? This would be the time. So until I see you next month, keep it cooking.